Okay, let's unpack this. We are diving into the fascinating world of medical tourism today.
Right, focusing specifically on India based on some, recent reporting we looked at.
Exactly. And our mission here really is to understand what's driving this growing trend.
And what it actually looks like on the ground for patients, for the hospitals too.
And the sources, they drop us right into a really powerful story. Kind of brings it all to life.
Yeah, you hear about Benoit Cabin. He's a businessman, right?
Yes, who traveled all the way from Congo to Delhi.
Which is quite a journey. And why? For a kidney transplant.
Something simply not readily available for him back home.
That immediately flags the whole access issue, doesn't it? Big time.
Definitely. And it wasn't just him. He had family with him.
Critically, his son, Alan, was the donor.
Yeah, the kidney donor. Incredibly brave. The reporting caught up with him, a couple weeks post-surgery?
Mm-hmm. And you get the cost to around $30,000.
Which is substantial, but we'll probably come back to the cost comparison later.
Right. But what really stands out, I think, is his reaction to the whole experience in India.
Totally. He was genuinely surprised. He didn't expect such good treatment in India.
He specifically praised the doctors, the surgeons, called them excellent.
So for him, it wasn't just, getting the surgery done. It was the quality of the care.
And the hope it gave him, returning home, living a normal life again.
They even got some practical advice, which I thought was interesting, like wearing a mask.
Yeah, because of the dust in Delhi, it's a small detail, but it shows that sort of on-the-ground reality, doesn't it?
It really does. So Benoit's story, while it's just one story, it feels like a perfect illustration of this larger wave the sources describe.
Absolutely. Overseas patients, and increasingly many from Africa, are becoming, a common sight in Indian hospitals.
This isn't just a trickle. It's fueling a genuinely booming market there. Medical tourism.
So if we connect that to the bigger picture, the main drivers are, they're pretty compelling.
It really boils down to a powerful combination, doesn't it?
It does. Access to high-quality healthcare. That's one.
And then the big one. Significantly lower costs compared to, other places people might go.
Right, compared to traditional destinations. The sources mention South Africa, countries in Europe, places where patients from Africa might have historically looked.
But the key insight here, I think, is the quality perception.
Exactly. The quality of care, the expertise in India, it's increasingly seen as equivalent to those places.
But the financial difference.
It's often just a fraction of the cost. I mean, that gap is huge. That's the core differentiator attracting people.
That makes perfect sense. If you can get comparable quality for something life-saving, like a transplant.
But save potentially tens of thousands of dollars.
Yeah, the decision becomes much clearer.
And it's not just advertising doing this. The reporting notes that word of mouth is massive.
Ah, right.
Yeah.
So when patients like Benoit have a good outcome, a positive experience,
they go back home, they tell people, friends, family, their community.
And that builds trust. It's organic, powerful.
You can really see the impact this is having on the hospitals themselves, too.
Yeah, the sources highlight how major hospitals, like Max Hospital in Delhi was mentioned.
They aren't just passively receiving these patients. They're actively adapting, capitalizing on it.
International patients are becoming like a really substantial strategic part of their business model.
That figure, 20% of annual revenue at Max Hospital coming from international patients, that's significant.
It's not just a sideline then.
Yeah.
It means real resources are being poured into this.
Definitely. Hospitals are creating specialized centers just for foreign patients.
And this isn't just a nicer waiting room, right?
No, it's comprehensive support. They help with, everything you'd need.
Like what?
Arranging translators, navigating complex medical forms, admin stuff.
Which must be daunting in a foreign country when you're ill.
Absolutely. And even helping families find accommodation nearby. It's becoming a very tailored service industry around the healthcare itself.
It just shows how deeply integrated this whole medical tourism thing is becoming into the hospital model there.
Yeah. So for you, the listener, what this deep dive reveals is this convergence of quality care that's available.
Radically lower costs.
And this enhanced patient support. It's genuinely reshaping global healthcare options.
At least for those who have the means and, the necessity to travel for treatment.
Absolutely. And it leaves us with a really important question to think about, doesn't it?
What's that?
Well, as certain countries, like India, increasingly become these major global hubs for medical treatment, destinations for healthcare.
Right.
What are the long-term implications, not just for the patients getting care,
but also for the healthcare systems within those host countries?
Yeah.
Their economies.
Exactly. What does it mean for everyone involved? Something to mull over.